The neurological assessment is composed of different tests of the motor and sensory to determine whether the nervous system is impaired. First is to assemble the equipment needed for the assessment. Then you should knock and introduce yourself.
Good morning, ma'am. I am student nurse Catherine, your student nurse from 8 a.m. until 12 noon today. May I know your name and birth date, ma'am?
Flores, November 4.
Okay, so today, ma'am, I'm going to do a neurological assessment. Is that okay?
So,
Perform hand hygiene and provide patient privacy.
I'll just be asking you a few questions. Do you have any difficulty with your senses like your touch, your sense of vision, your smell, your hearing, your taste?
I have vision problems. I'm nearsighted and I wear glasses.
I see, ma'am. So do you have any pain in your head or in your back?
I've had headaches since this morning.
If the patient displays difficulty speaking, point objects in the room and ask the patient to name them. Ask the patient to read from a printed material apt for her educational level. Ask the patient to respond to verbal commands.
Can you point to your nose? Ma'am, can you tell me your full name?
Daniel Curtis Z. Flores.
How about your mother's name?
Ardel Z. Flores.
Ma'am, can you tell me your full address?
Block 6, Lot 20, Everlasting Street, Antipolo Hills Subdivision.
Do you know where we are now?
In a hospital.
Ma'am, do you know what day is it today?
It's Friday, May 10, 2019.
Do you know what time is it now?
It's around 9 a.m.
Ask about difficulty with memory. If problems are apparent, 3 categories of memory are tested.
So, ma'am, I'll be reciting a few set of numbers and you can repeat it after me. 5, 3, 1.
5, 3, 1.
5, 3, 1, 2.
5, 3, 1, 2.
5, 3, 1, 2, 4, 7.
5, 3, 1, 2.
Ma'am, could you repeat the sequence for me backwards?
1, 3, 5.
What did you eat for your breakfast today?
A sandwich.
Did you take any medications?
No.
Ma'am, what year did you graduate in your junior high school?
2016.
Ma'am, could you spell the word bag for me?
BAG.
And then repeat it to me backwards.
GAD.
Ma'am, what is 3 plus 2?
5.
What about 10 plus 3?
13.
Ma'am, what is 5 times 3?
15.
What about 10 times 4?
40.
Ma'am Ella?
Yes.
State the level of consciousness.
Ma'am? Yes, ma'am. Ma'am? 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 Ma'am?
The Glasgow Coma Scale is the summation of scores for eye, verbal, and motor responses. This is the most common scoring system to assess the level of consciousness of a patient.
Rate the GCS and state significance of findings. For the olfactory, ask the patient to clean nose and then close their eyes. Occlude one nostril and identify different mild odors.
Alcohol.
Repeat the procedure for the other nostril.
Coffee. Alcohol.
Then state the significance of findings. Ask the patient to read a magazine. Observe closeness or distance of the page to the patient's face. For the distant vision, position patient 20 feet from the Snellen chart and ask her to read each line until they cannot read the letters.
L-O.
Position yourself about 2 feet away from the patient at eye level. Ask the patient to cover her right eye while you cover your left eye. Fully extend your right arm at midline and slowly move one finger upward from below until the patient sees your finger. Test the remaining 3 visual fields of the patient's left eye and then
Yes.
repeat the test on the opposite side.
Yes.
Inspect margins of the eyelids of each eye. Position at 2 feet in front of the patient and instruct the patient to focus on the object you are holding. Move the object through the 6 cardinal position of gaze or the wagon wheel method. This is done in a clockwise direction. Observe the patient's eye movement. Assess size and shape of pupils and then interpret findings. Dim the light. Then ask the patient to look on a distant object. Shine a light obliquely into one eye. Then observe for the pupillary reaction and interpret the findings. Shine a light obliquely into one eye and observe the pupillary reaction on the opposite eye. Hold the pencil 12 to 15 inches from the patient. Instruct the patient to focus on your pencil and to remain focused on it as you move it closer towards the eye.
So, ma'am, your pupils are equally round and reactive to light and accommodation.
For the trigeminal, instruct the patient to clench their teeth while you palpate the temporal and masseter muscles from contraction.
This test, ma'am, kindly close your eyes and then tell me if what you felt is sharp or dull. So, ma'am, this is sharp and then this is dull, ma'am. Dull, sharp, sharp, dull.
Stroke the face with a cotton wisp and ask the patient to tell when the sensation is felt.
Yes. Yes. Yes.
Have the patient to look up and away from you and then lightly touch the cornea of one eye. Repeat on the other cornea.
Smile. Round. Soft cheeks.
Ask the patient to cover one ear. Stand about 1 to 2 feet away from the side of the ear being tested and out of the patient's line of vision. Whisper a combination of 3 numbers and letters in random and ask the patient to repeat what you have spoken. Repeat the process with the other ear. Strike a tuning fork. Place the base of the vibrating tuning fork on the midline of the patient's head or forehead. Ask the patient if sound is heard equally in both ears or is it better in one ear. Place the base of the vibrating tuning fork on the patient's mastoid process and ask the patient to tell you when the sound is no longer heard. Quickly position it 1 to 2 centimeters from the auditory canal. When the sound is no longer heard, time the interval of bone conduction and the air conduction. Compare the number of seconds from the bone and air conduction. Ask the patient to close her eyes, then to stretch out both arms with palms facing up. The arm should remain in this position equally. Using a tongue depressor, let the patient test different flavors.
So, ma'am, this procedure will be uncomfortable. Say ah.
Observe for the uvula and soft palate. Using the tongue depressor, touch the posterior pharynx. Ask the patient to shrug shoulders against resistance. Ask the patient to turn head against resistance, first to the right, then to the left. Inspect the patient's tongue. Ask the patient to move it from side to side. Then ask the patient to push the tongue against the cheek as you apply resistance with an index finger. Then repeat on the other side. Place the palm of the hand down. Palpate the bicep tendon in the antecubital fossa. Deliver a blow with the percussion hammer to your thumb. Palpate the tricep tendon about 2 to 5 centimeters above the elbow. Deliver a blow with the percussion hammer directly to the tendon. Tap the tendon at the radius 2 to 5 centimeters above the wrist. Ask the patient to look up or interlock fingers and pull. Deliver a blow with the percussion hammer directly to the tendon just below the patella. Observe the normal extension. Slightly dorsiflex the patient's ankle. Deliver a blow with the percussion hammer directly to the Achilles tendon just above the heel.
Ma'am, my reflex score is 2, which is normal.
Stroke the lateral border of the sole of the foot, beginning from the heel towards the ball of the foot, curving medially across the ball. For the Babinski's reflex, observe for the fanning of toes.
Today, ma'am, I'll be doing the meningeal signs. But before I do that, can I ask if you have any cervical injury?
Place your hand behind the patient's neck forward until the chin touches the chest if possible. Identify normal from abnormal findings. As you flex the neck, watch the hips and knees in reaction to your maneuver. Flex the patient's leg at both the hip and the knee and then straighten the knee. Repeat on the other side and then identify significance of findings. Ask the patient to walk naturally across the room and then back. Patient should not be aware that you are observing them, and then assess the patient's gait. Ask the patient to stand with feet together, arms resting at the sides, with eyes open then closed. Note any unsteadiness or swaying. Ask the patient to stand on one foot with eyes closed. Repeat with the other foot. Ask the patient to walk a straight line, placing the heel of the one foot directly in front of the toes of the other foot. Ask the patient to walk several steps on the toes and then on the heels. Ask the patient to abduct and extend arms at the shoulder height and rapidly touch nose alternately with one index finger and then the other. Ask the patient to pat both knees with the palms of the hand, alternate with the back of the hands at an increasing rate. Ask the patient to touch their nose and then your index finger. Ask the patient to spread arms, then bring fingers together at midline with eyes open, then with eyes closed. First slowly, then rapidly. Ask the patient to touch each finger with one hand to the thumb of the same hands as rapidly as possible.
Okay, so ma'am, can you please put your heel on your knee and then roll it down your foot?
Then repeat on the other foot.
Using your toe, can you please point to my finger? And the other foot?
Ask the patient to close eyes and instruct to say yes or no whether the patient feels the cotton wisp touching the skin. Ask the patient to point to the spot where the touch was felt.
Yes. Yes. Yes.
If areas of sensory dysfunction are found, determine the boundaries of sensation by testing responses approximately every 2.5 centimeters in the area. Make a sketch of the sensory loss area for recording purposes. Ask the patient to close her eyes and to say sharp, dull, or I don't know.
Ito po yung sharp. Ito po yung dull. Ganyan.
Sharp.
Ito po yung dull.
Dull.
Ask the patient to say hot, cold, or I don't know as you touch the area of the skin.
Cold. Cold. Warm. Up. Down. Left. Up. Down. Right.
Kindly close your eyes.
1, 2, 2, 1.
Direct patient to close both eyes and place familiar objects.
Key. Brush.
With eyes closed, draw a number or letter into the palm of the patient's hand.
A. D. F. Here. Here. Here.
Now, ma'am, we're done with the examination and thank you so much for your cooperation. Now let me assist you with your clothing.
Document findings in the patient record.